Hi, everybody. Thank you. Thank you for being patient. I had to update my Chrome browser at the last minute. It was fine last week, and all of a sudden this week I had to update it in order to be able to broadcast. So thank you for your patience. I hope everybody is doing very well. I hope everybody's staying safe and staying healthy and managing through this unprecedented time where we are dealing with this pandemic. We've had quite a few people already that have been able to utilize the immune booster. They've come in for the IV, they're using the supplements, and I congratulate you for taking such good care of your immune system, and I'm so happy you were able to utilize that. So we've been talking about peptides, and peptides are amazing. We have some questions we're going to be answering, and I want to talk to you a little bit more about some of these peptides and why do we why do we use them? Why do they work so well? And what's the whole story with peptides? There's so many different areas of peptides, and it's a very dynamic field. So new ones are coming up. There's more research coming out about the ones we already know about or we already have. And there are some regulation changes that could be happening with the FDA when it comes to peptides as well. One of the things I'd like you all to know is there are some peptides that are under name brand pharmaceutical names. So the pharmaceutical industry is also doing a lot of research in peptides and bringing certain peptides to the market. So the peptide medicine is really exciting, and it's the technology of today and for tomorrow, in my opinion. So one of the peptides that is FDA approved, and it's also in the compounding pharmacies, is a peptide called PT141, also called bremelanotide. They mean the same thing. And bremelanotide is an amazing peptide. It's actually a piece off of the melanotan peptide. I'm going to talk about melanotan in just a second. But in the melanocortin system, they took the melanotan peptide, which is a tanning peptide, and there's a component to the melanotan peptide that was shown in the research to increase libido and intimacy experience for both men and women. And this was a wonderful discovery, considering we don't have a lot in the traditional pharmaceutical world that helps with that component. And what they found when they started studying this was that the bremelanotide actually improved both. It had an improvement in ED, and it had an improvement in the overall experience in 80% of men who did not respond to Viagra or Cialis. So, and the bremelanotide isn't focused on the vascular system. It's focused on the nervous system. And for women, that was also a significant increase in satisfaction with the intimacy experience and desire and libido. And PT141 is very safe. It's an injectable peptide, and a lot of people just don't know that it's out there. It's peptides need to be prescribed by a physician. So you want to be, if you are interested in looking at peptides for yourself or for somebody that you love, you want to be able to find a physician who knows about peptides and can appropriately evaluate and prescribe for you or for the person that you know. So that's one of the peptides that is not on the list of things that we may have some difficulty getting with what's happening with with the FDA's made a couple of decisions. And the other that I wanted to mention, and I've mentioned this before, give me 1 second. I'm having allergies. It's that time of year. So sorry if my voice seems a little hoarse. I'm not sick. This is just my typical allergic to Florida in May. So GHK copper, also called copper GHK, it's the same molecule, is I've been using it in an injectable form, and I love that form. That form may be difficult for us to get for now, but the topical that you can use in skin creams and you can use on the skin is still going to be available. And this is an amazing peptide. This peptide has so many areas that it works in. And we have at least one study that showed there was significant systemic absorption of the peptide when it was used in a topical form. Just have to make sure you get the percentage right, that you don't have a really low percentage of copper GHK. It should be the right percentage in the cream and in the proper delivery mechanism so that it gets across the skin and stays intact and can work systemically. So GHK copper is profoundly anti-inflammatory. It also is part of the collagen process. It helps our body make collagen. It helps our body make more collagen and better collagen. And it actually works even on the genetic level to help upregulate our body's ability to make collagen. And there's some interesting studies on GHK copper. There's a lot of studies on it, actually. And you'll probably have seen some skin creams that have GHK copper in them in some of the higher end and certainly medical grade. And the reason for that is it's a fantastic product to put on your skin. Putting it directly on your face and on your neck is it's wonderful, and it has all the other benefits to it. I've had significant pain relief reported from my patients who are using GHK. It's part of that decreasing the inflammatory process, upregulating collagen, helps your joints. And that's a wonderful, wonderful multiple benefit peptide to be able to have in your arsenal. Some of the other ones, let me see. I wanted to share some less known maybe peptides with you. The growth hormone secretagogues, we mentioned those before. The CJC1295, Impamrellon. Sermorelin was the first one. What those do is they help your body release more of its own growth hormone. So you're not giving growth hormone exogenously, which means injecting it from outside the body. You're actually just getting your body to release higher levels of more growth hormone. And growth hormone secretagogues like Impamrellon and CJC, they work differently. There's one's a growth hormone releasing hormone, one's a growth hormone releasing peptide. They actually sit in different receptors to have a similar outcome with an increased releasing growth hormone. Why that matters is growth hormone is profoundly helpful at healing tissue, recovering tissue, keeping lean mass, decreasing excess body fat. So many things about our own growth hormone that are super beneficial for a peptide like that. And they work very, very well when you're testosterone optimized. Testosterone is also one of those things that will help your body release more growth hormone. So we'll talk about testosterone in a whole other event because there's a lot to say about that. But for fat loss and muscle gain, for better sleep, better recovery, helping to heal tissues, a growth hormone secretagogue. I like the CJC1295. It has very low side effects. It's very effective. It's one of the peptides that we may have to wait a while until it's under an IRB to be studied. We've had it for a while, but it may be off the market for a little bit. But we're in the peptide world. We're working our hardest to keep all of these great peptides available for you all. So, memory and cognition. This is an area that affects every one of us at some point. We want to preserve all of our concentration, our memory, our focus, our ability to have our brain work the way we would like it to, as fast as we would like it to. And there are some peptides that can really help with that. One of the big focuses that I like to remind people about, that when it comes to the brain, you want to be able to keep your antioxidants on board. Antioxidants like vitamin C is a good antioxidant. Omega-3, excellent antioxidant. And excuse me, melatonin, amazing antioxidant for the brain. So, as there's processes that happen, cells are making energy, they're doing their thing. There's cellular waste products that need to be cleared out. There's what's called free radicals that get formed when a chemical reaction happens. There'll be a reactive oxygen species. Those are things that we don't want to keep in our brain. We want to clear that out. And we have peptides that are really, really good at that. Probably the most well-studied is cerebrolysin. And cerebrolysin is not available readily right now, but it's very well studied, and I like you all to at least know that it's out there. It's the people that have been using it have been very, very happy with its results. It's one that I'm hoping will have readily available again very soon, under study if necessary. And I want to go back to BPC 157 also. So as I've mentioned, it's one of my all-time favorite peptides. BPC is body protective compound. It's an isolate from human gastric juice, and it's actually pleiotropic, meaning it works in different ways in different tissues. And it's also had some study and focus on helping with the brain, helping with after a traumatic brain injury, after a stroke, in helping get that inflammatory cascade down in the brain and help the brain to recover. And BPC had been available in multiple different forms, including an oral capsule, and right now an injectable. And that's how I had used both the oral, the topical, and the injectable in my practice. The injectable is going to be unavailable for a period of time, most likely. I'm hoping that this time will not be a long period of time because it's a great peptide. And but we will hopefully be able to continue having oral BPC. It may be a little period of time until it is available in the market under kind of this new situation that we have with the FDA. But oral BPC is amazing. It's been studied in showing that it can actually reverse the gastritis that can be caused by nonsteroidals like Aleve and Advil and aspirin. It's helped with Crohn's disease and helped with general gut issues, whether it's diarrhea, constipation, gut problems. BPC is amazing, and hopefully we'll be able to continue to use that orally. My experience with it is that having it orally is certainly better than not having it at all to be injected, but the injectable form has been extremely effective at pain relief because you can inject it. It gets systemic very quickly and easily, but it is one of those that's stable to take orally because it comes from gastric juice. So BPC, still one of my favorite all-time peptides, super safe, very well studied, mostly Croatian studies. They've been studying it for a long time. So those are, let me see, I want to give you one more, maybe we haven't mentioned. We've talked about thymosin alpha. I think we've talked about thymosin beta. There is another peptide that it's called Sealink, and Sealink was available as an injectable, but also as a nasal spray. And Sealink had some amazing properties to it. It was most known to help with anxiety and help with sleep, but it's also been studied and shown to improve cognition, improving memory, improving focus, and in higher doses, which are safe, was helping with pain. So one peptide that did all of those things, and one of the few that you don't have to inject. Yes, a lot of people don't enjoy needles. I understand that. I don't like them that much either. These are little tiny needles, but they're still needles. And if you have a peptide that's deliverable either through the skin, through the nose, or in the, as a capsule, that's always nice to be able to have that. Another peptide that was really, really good for cognition and was actually studied preliminarily, at least in Parkinson's disease and some in Alzheimer's disease, was dihexa. And dihexa is a nootropic. It's a neurocognitive peptide, and it was also first developed as a topical. You put it on the skin and let it absorb and do its work. So I'm hoping that all of these that have been in our arsenal and effective and well studied will continue to be available to us one way or another. One of the things that happens, if sometimes when something is, they want you to study it under a very structured manner. Even though there's a lot of studies, we know safety and efficacy. Our FDA is, they're out to protect the consumer. And there's a kind of a well-known pathway. You first start with the IRB, or Investigational Review Board, and you submit what it is that you're looking at, and that can hopefully go on to an investigational new drug. And there's pathways to get these things to market that, and that may be, some of these peptides may have to go down that road, and I will do my best to keep them going down that road so I can keep them available for you all. So Sean is with me in studio today, and
good afternoon, Dr. Heather.
Good afternoon, John.
So we have a bunch of questions. We have a lot of people watching, a lot of questions about peptides.
Oh, that's awesome.
Today, and let's jump right in.
Okay.
So some of these questions came in advance to your live stream. We sent out an email to your list, and if you're not on Dr. Heather's email list, you can get on her email list for free if you go to drheather.net/subscribe. And then you'll get notifications like we sent out about this one, asking for questions in advance. So that said, Jeff asks, so I know this sounds like a dumb question, but
Never a dumb question.
for a non-medical person, what exactly is a peptide?
That's actually a great question because, and my brother will attest to this, I tend to get in my own little nerdy world of terminology, and I don't mean to do that, but that's a totally reasonable question. A peptide. So this is what's so cool about this. A peptide is basically a chain of amino acids. So you have amino acids are the building blocks of proteins. So you have, a whole bunch of amino acids, lysine, arginine, and they will bond together with each other in a very specific pattern and one after the other in a very specific way to create a peptide. Now, the definition of a peptide has changed a little bit. If you look back in some of the older textbooks, you'll see that a peptide was anything less than 100 amino acids, and anything over 100 amino acids was considered a protein. Then that started to change to 50. So because it's just a matter of amino acids bound together in a specific way. But if they get really long or it folds and it interacts with it, it's called a protein. But it's all amino acids bound together. Then the definition was anything less than 50. And there was still two different sources that were saying, less than 100, less than 50. And then the most recent one I've heard was anything less than 40. So less than 40 amino acids is considered a peptide. So it's like a small protein or an active fragment of a protein. So some of these proteins are humongous, and they have multiple centers that sit in different receptors in different tissues and have different actions. And if this little section of this big protein is supposed to sit in this receptor, then like the melanotan, for example, it sits in the receptor, causes your body to produce melanin. Then they figured out how to do this, which is amazing technology and science, is to take just that section or the big enough section to sit in that receptor and have the desired outcome on the other side in the cell without the whole protein. So that's really what a peptide is. Most of our peptides are working inside the cell or in the cell membrane. They're intracellular at the nucleus, at the mitochondria. They are affecting changes in that environment, which is really cool. I hope that answers that.
So peptides are not drugs.
No, but that's they're not drugs, but there are some peptides that, because of their complexity or because of their size, there's been some question about whether they should be considered a drug. It's technical and kind of legal terminology, and some of it changes a little bit.
But one of the reasons you like to use them so much is because you use them with regenerative medicine. They work with your body. They're natural substance that works with your body.
Yes.
With very low side effects, unlike a drug, right? Very low side effects, right. And they work on a different level than a drug would be, in a non-technical, non-medical way to put it.
Yes. Well, a lot of times when we think about a pharmaceutical that was created with one therapeutic target in mind, and then all of the side effects you need to worry about, it comes with the package. But in a lot of nutraceuticals, holistic medicine or vitamin medicine, and a lot of times in peptide medicine, we're looking for that one effect as well, but there's not undesirable side effects. Usually, if there's a secondary effect, it's something that's good for the body, like, and it also helps your immune system, or, and it also helps your skin, or, it helps your sleep. Or, all of these kind of positive secondary effects rather than unwanted side effects with peptides. And they are mimicking substances or pieces of substances that are sequenced in a lab, but that exist in our own body.
And Dr. Heather, are there dozens of peptides or hundreds of peptides?
There's hundreds, at least hundreds of peptides. Yeah, the first peptide ever sequenced outside the body is insulin. Insulin is a peptide, and that was done in 1965. That was a long time ago.
And they can be used as individual peptides or in combination. And that's what you do with your Peptology protocols, right?
Yes.
You use specific combinations of peptides to achieve a better result than any one would ever give. Is that right?
Yes, I do. We've got understanding what the individual peptides do, why we would use them, how their mechanism of action actually works in the body. When you have that, you can put together peptides in a specific dosing and in a specific way that give you a much more augmented response. So you're really ramping up the ability for the body to heal, or you're really ramping up the mitochondrial peptides that help the energy battery in each one of your cells to, produce more, to make more mitochondria, to have a higher energy output. So yes, there's combinations that we like to use together, and I've been using them in practice for so long, and I had a lot of my friends in the medical world asking me, well, which ones do I put together? So that's why I put together a course, so that they could learn that, and they could know how to use these together to get the best response you can for your patient.
And we're going to share a link to that in a few minutes for those who are physicians or providers who would like to learn more and study your protocols. Mm-hmm. But let's move on. We have a lot of questions here. John asks, enjoyed your podcast with Dave Asprey. I have a question. How does one get involved in the field of peptides? Is it only open to doctors?
The field of peptides is not only open to doctors, but you have to be a prescribing physician to be able to prescribe them for patients. So usually they're not considered controlled substances the way testosterone would be, but you need to have a license that you can prescribe some kind of scheduled medications just to make sure that you're prescribing within your license to be able to prescribe peptides for patients.
Okay, so you mentioned that although peptides are not drugs, the FDA, the Food and Drug Administration here in the United States, are looking at peptides in a different way, in a new way similar to drugs. And so it's making the waters a little murky, right? So the question is from Carrie. Carrie asks, how are you handling the FDA and their restrictions on peptides?
That's a really good question. It's been such a dynamic situation for all of us, and we don't know yet exactly how everything's going to fall out because it's still in the middle of being decided. But the FDA is looking to protect consumers, and there's not been any harm done with legitimate peptides in a legitimate pharmacy with legitimate physicians. It's not that they're dangerous. It's that the industry doesn't. They're looking to have these much more structured and more focused with research and under an IRB, and have them looked at a little bit more carefully and who can prescribe them. But the last I heard, there was not a discussion about having regulation yet for us. That's what they did in Australia. In Australia, they went through a similar process with their regulating body, and what they decided to do was to regulate them. So they didn't make them unavailable, but you had to, they went through a rigorous process of being tested, and which places were making them and making them available were all inspected as being part of that regulation, and who was prescribing them. So that's hopefully, something that may be considered at some point, that, to make peptides are prescribable anyway. There is a lot of peptides that are available on the internet, and that is obviously a cause for concern for anybody who's trying to keep your patients safe, because they're for research only, and it's listed right on there that they're for research only. You can't buy peptides legitimately. It's a prescription. You have to be prescribed them. So they're out there and available, but they're right on the bottle that it's for research only. And that means that it wasn't intended to go into a human body, and it wasn't tested for that. So I think that they're that's a legitimate concern of any regulating body.
So anyone who wants to get peptides really should go through a physician. They have a much better chance that they're going to be safe. Is that right?
A physician who's had peptide training, yes. The American Academy of Anti-Aging Medicine, A4M, they had, that's the peptide training I took. I was in the first class of fellowship that they offered. And so there are physicians who've been trained, in a large training body like that. That's an international organization. And then, of course, there's my course is available to any physician who wants to learn how to prescribe peptides. And so I just want everybody to be safe and have them have success with their peptide therapy. If you got the wrong peptide at the wrong dose for the wrong patient, just like anything, you're maybe not going to get the result you want.
Great. Marilyn asks, have you ever heard of a compounding pharmacy creating peptides in oral form?
Yes, but they're the only really available that have been studied in oral form that can absorb into the body are BPC 157, and there's an oral form of AOD 9604. We haven't talked about that peptide. AOD 9604 is another piece of the growth hormone molecule that has some specific actions. And there is an oral form that's been created, and they're looking at it for pain relief. Really pretty exciting research that's going on with that. And BPC 157 is known as an isolate from human gastric juice, but the majority of other peptides, I have to look at it from peptide to peptide to peptide, but the majority of them do not survive the digestive juices and have any significant systemic absorption. So just because it's made in an oral form doesn't mean it's systemically being absorbed. And that's pretty well studied in most of these peptides. They're looking for all avenues. Not every peptide can be put in a nasal spray. There's enzymes in the lining of your nose that will break down a lot of peptides. So they have to be studied to make sure that that modality is keeping the peptide active and intact.
Okay, Marilyn and Jeff are both asking the same question. Are there peptides for hair loss?
Yes, there totally are. And it's such an exciting area because while Rogaine, minoxidil, while those work better, they work better for some people than others, that's one avenue of trying to help with hair loss. In the peptide world, we have several. We have PTD DBM, which I don't expect you guys to remember all these peptides. We have to come up with jazzier names that people can remember. But this is a topical, along with the valproic acid topical, that works incredibly differently on hair growth. The zinc thymulin is another one. So we're focusing on the hair follicle in all the different stages of growth. So we get a healthier follicle, a bigger follicle, a higher number of follicles, and then you bring in the zinc thymulin, and we're making a better blood supply to the follicle. It's crazy. And then thymosin beta-4. Thymosin beta-4 has been looked at and shown to be just amazing at helping with hair growth. So you can imagine the perfect storm of bringing all that together. And of course, it's important to try to understand why the hair loss is happening. If it's because you're hormone optimized, and sometimes testosterone makes a metabolite called DHT, and it can cause hair thinning in women or hair loss, undesired hair loss, then you want to make sure that we know that that's what's going on so you can do things to help reduce that. If it's because your thyroid isn't optimized, low thyroid is classically known, especially in women, with very thinning hair or just fulminant hair loss. So trying to know why do we have the hair loss is also part of that. But yes, awesome peptides for hair.
Great. We've got lots of questions and comments. For those who are watching live, please drop your questions in the comments section. And if you have a comment that you'd like to share with Dr. Heather, she always likes to receive those, especially if they're positive in nature. We love to see those hearts and thumbs up.
Love the positivity.
And sharing. If you know somebody who might be interested in this live stream, please hit that share button and share that with them. Or if you're in a group, share this with them. We'd appreciate it. Dr. Heather just wants to help as many people as possible. So a few comments. Iris says, I just discovered you a few days ago. Your guide is an excellent resource for my research. Thank you.
Oh, you're welcome, Iris. I'm so glad that it's helping you.
Let's tell people about your guide, and I'll drop the link in the chat here.
Okay. Well, some of the peptides that I've been mentioning, what I put together when I went on the Dave Asprey Bulletproof Radio, which was an amazing experience. If you have a chance to listen to that episode, Dave is he's so amazing. He's so brilliant and so experienced in this field of integrative medicine. His books are great. And I put together a guide at that time for his listeners, and it was really well received. And what I thought was, there's people that don't know about peptides. This is so cutting edge that a lot of physicians don't know about it yet. It's just not in the mainstream at all. And they might be wondering, well, why would peptides be relevant for me? So I just took the 10 top conditions that we could have, whether it's memory loss or whether it's sleep or whatever it might be, and listed at least one peptide, at least one that has been studied and used in my practice and known to be helpful for that condition. And I put it in a little guide so that people could have kind of the nice introduction to, well, why would peptides be so great? And they're so great. I love them.
So to get Dr. Heather's free guide of 10 common conditions treated by Peptology, go to drheather.net/Peptology guide. That's drheather.net/Peptology guide. A couple of the comments. Gary says he's been taking CJC 1295 and it is awesome!
Yes.
Exclamation point.
Yay. It is awesome.
Kathleen says, thank you, Dr. Heather! Exclamation point. I love AEO 9604. Great results with recovery.
The AOD 9604.
Oh, sorry, AOD. Okay.
9604. Isn't it an amazing peptide? And I think that AOD doesn't get quite enough attention. When AOD is put also in combination with other peptides in the skin, it's really amazing what can do, because that is a really highly proliferative meaning it really helps tissue grow and recover and regenerate section of the growth hormone. So it's wonderful peptide.
Okay, back to questions. Jeff asks, I would like to try some oral BP157 for improved gut health. Where can I buy some?
So that's a really good question. You can't buy it. You need to have it ordered for you. And right now is kind of that transition point where we're not sure if the BPC 157 in oral form is going to be available just yet. I think that it will be if it's not during this transition, but it's still, if you leave your contact information or sign up for the newsletter, I'll make sure to let you know, Jeff, when we know kind of how all of that's going to go down. And literally, we're just day by day, not quite sure if we're able to order certain peptides for people. And it comes in a couple of strengths also. I usually recommend a 30-day course to start with. It's safe to take it longer. It's a little bit expensive, so I think doing it for 30 days tends to give people a good idea of how much it's going to help them.
So Jeff, to contact Dr. Heather, just go to drheather.net/contact. It's drheather.net/contact. Fill out the form there, and someone will be in touch with you as soon as we have that information. Emily asks, how long do peptides in powder form last when you receive them? I don't have a freezer that goes to -4 degrees Fahrenheit as recommended. Does that mean they won't last very long? Great question.
That's a great question. And it's going to be different from peptide to peptide. Usually, there's a best use date on the bottle, and anything beyond the best use date doesn't mean that it's not good. It means that it hasn't been tested to be fully potent beyond that date. My experience is the lyophilized form or the powdered form tends to have a little bit longer shelf life with certain peptides especially. Once you reconstitute it, which means you put the sterile water in it and make it liquid now, then it seems like that's when you've got that more narrow window. Some peptides are 3 months, some are 30 days, and some are a little bit longer than that. But usually it's stable. You don't usually have to freeze it with at least most of the peptides we're talking about here. And it should have a best use date on it, because the pharmacy, they will make a batch, and you want to know from the date that they made it to when the best use date is. It's not always right when it arrives. It's not from that date. It's from the date that it was made in the pharmacy.
Emily had a couple follow-up questions. One is, should you store the reconstituted peptides in the fridge or freezer while you are dosing?
Refrigerator. The refrigerator. 100% refrigerator. Yes.
Okay, there you go.
To go along with that, TaylorMade Compounding, which is the pharmacy that I use the most, pretty much all my peptides are from TaylorMade. They've made some peptides that nobody else has made. It's a great company. I have no financial affiliation with them at all. They just make good peptides. Their peptides have been shown to be stable in room temperature for up to 7 days. You shouldn't leave them out, but it's good to know if you did need to travel and you were taking your peptides with you, you don't have to bring a medication refrigerator with you with their peptides. The way that other people have it in their stability testing, I'm not sure, but I know that theirs are stable up to 7 days in room temperature. So, but other than that, don't put them in the freezer, put them in the fridge.
Emily also asked, and I saw this question earlier as well, how do you feel about mixing peptides in the same syringe? Say GHK-Cu and melatonin? Melatonin or Epitalin, for example?
So it's a very, very good question. And I will tell you that there's solid opinion on both sides of this subject. I have spoken to PharmDs who are peptide PharmDs. They're the ones who are actually making the peptides. And they have told me that if you can't combine them and leave them sitting combined so that they can mix together. But if you're combining them and injecting them right away, if you're drawing from the bottle and you draw from the other bottle and you're injecting it right away, they felt that was adequate, that if you're going to lose any, you're going to lose a small amount of potency by doing that. But just as passionate of an opinion on the other side of that comes from a revered teacher and researcher in peptides, and he has a very strong background in molecular biology, and he says that it does matter, that those bonds are very delicate, and if they haven't actually been tested to sit in a bottle together the way some of the peptides are, for example, you can get CJC and Impamrellon as a combined product, at least you could, because they tested it to make sure that when those two sat together, they stayed completely stable and they didn't interact with each other in an undesirable way. You're always taking a risk if you're combining them in a syringe that they could interact with each other in an undesirable way and just lose some efficacy. You can break some of those bonds. So, some of my protocols have quite a few peptides or quite a few injections involved. And, you get tired of injecting yourself lots and lots and lots of times, especially if you're a small person like me. But it's kind of, that'll end up being your decision. I like to just empower you with knowledge that that's what the experts have said. So the purist will say, never combine them unless the pharmacy tested them combined. And then the other folks will say, if you're combining them and injecting them, you're losing probably just a little bit of product.
And one final question from Emily. Can GHK-Cu be injected anywhere to have potential beneficial effects on the face?
Injected in the face? You can inject GHK in the face. Yes. You're really looking to inject in a subcutaneous area. When I use GHK in my regenerative practice, I use it in a lot of different tissue types. But if you're injecting specifically in the face, if you have a specific area that you're trying to treat with it, you can inject under the skin the GHK. You can inject it anywhere that there's, subcutaneous tissue. So yeah, you can.
Okay. Peter asks, is there a proper dosing and duration protocol for melatonin 2?
Melanotan 2?
Sorry, melanotan 2. Non-medical over here.
Okay. The names of these peptides are not easy.
At least it's not melatonin. Melanotan 2.
Melanotan 2. There are protocols with melanotan 2, and it kind of depends on what you're looking to achieve. So if you're looking for the tanning properties of melanotan 2, typically I recommend you start out with only 10 units because it can make you feel a little nauseated. It can cause flushing and make you a little nauseated. And for some people, that nausea can be more than just a little bit. It doesn't last, but nobody likes to feel nauseated. And you want to know how sensitive you are to that in a small dose. And you can do that daily, 15 units or 10 units until you reach kind of a desired coloration if you're using it for tanning. And then you can do a maintenance just a couple times a week with a little bit of a bigger dose. A couple times a week, we'll do a maintenance for the tanning. For the other properties, for the autoimmune, the inflammatory, the sleep, then you're probably going to use it a little bit more frequently and just tolerate being a little bit more tan. Most of the patients who feel tremendous benefit with their pain, their inflammatory pain, and their autoimmune stuff, they tolerate being more tan because they feel a little bit better using it a little bit more frequently than that.
Okay, lots more questions coming in. Really, really great questions with not too many medical terms, which Sean appreciates. Donald says, loving this live stream. Thank you, 3 exclamation points. Big
Yay,
smiley face.
Thank you, Donald.
2 quick questions. 1, any peptide protocols / combinations to help heal a minor inguinal hernia?
Inguinal hernia.
Yeah.
Yeah.
And then he says, for example, BPC /TB500 /GHK-CU ?
Yeah, no, that's a wonderful question, but that borders a little bit in the medical advice, and I'm not really allowed to do that in this forum. So if you're interested in learning more about what I would do with those peptides as a in a medical counsel setting, please just contact our office.
drheather.net /contact.
And I'd love to give you some ideas on that. They have rules. So
Same, this may apply to this as well. That may apply to this question as well, but I'll ask it, how long do you recommend using a low dose, i.e. 30 to 1,000 mcg per day of Epitellin for anti-aging purposes, and how long to wait before running another course?
yeah, unfortunately, that also falls into medical advice. I'm sorry. I wish I could just blurt it out, but we're not allowed to do that. It's just got to be more informational sharing. As you know, I like Epitellin as a small nightly dose. Almost all peptides seem to do better if you cycle them. These peptides are safe to continue to use them, but almost every peptide, there comes a period where you can use it for 3 months, 4 months, some of them for 6 months, and then you give your body a break, your skin a break from injecting, and just let, cycle off of it for a little while. So, yeah.
Okay, Jeff asks, I have severe arthritis in my shoulders and have been told I may need a shoulder transplant in the future. Can peptides help me?
Well, in my experience, absolutely. We actually have, there's one peptide in particular, there's a combination of things that I really like, even with severe arthritis. And one of them is Pentose and Polysulfate 54. We just call it Pentosan these days. But Pentosan was studied and actually showed regeneration of articular, meaning the joint cartilage. It's profoundly anti-inflammatory. It has several other properties that are awesome, but we do have some peptides in our arsenal that will help with that, with our significant osteoarthritis and degenerative joint disease. And of course, don't forget about regenerative option. I have taken care of some joints that the patients were told you have no other option but a replacement, and they've done very, very well. It's wonderfully surprising how well what's considered an end-stage joint can do once you get the inflammation out of there. You get it to articulate better because it's stable, and it can really be. I've treated quite a few joints that were told there's no hope for, and they did well.
Okay, Chris asks, I have arthritis in my ankle due to an injury. Can peptides help with that type of arthritis?
Yes. The short answer would be yes. Not knowing the history and what things look like in there, but if you had an ankle injury and you end up with traumatic arthritis, which happens in a lot of joints after a trauma, the there are peptides that are really actually been studied in and are really good for joints.
Okay, Peter asks, can you discuss Semax?
Cmax?
Cmax, S-E-M-A-X. Sealink, Sealink,
Sealink. Yep, I mentioned Sealink earlier.
And TB4.
How much time do we have?
I think, we originally were planning to go for a half hour. We're now at 51 minutes, 51 minutes. So it's your choice, Dr.
Well, I'll at least give you a little ditty on. So Cmax and Sealink are often used together where they've not been combined in the same bottle. I would love to see that product made, but it hasn't been made yet. But Cmax had been studied and used to help elevate mood. So for people that have depression or people that have a depressed mood, Cmax has been excellent at that. And the alternating of Cmax and Sealink is a way that I've used those peptides in practice, and it's a very effective, and it's also a nasal spray, so it's not injecting, so Cmax is a wonderful peptide, super safe, and it can also help with sleep. Both of them can help with sleep and waking up the brain. So, okay. And then thymosin beta-4 is a huge discussion, but I will tell you that it's one of my favorite peptides right there with BPC 157. Thymosin beta-4 is present in our body, and when we get an injury, any kind of an injury, it's one of the first things like peptides that's upregulated by the genes. The genes turn on and start making large amounts of thymosin beta-4 in response to injury. It's incredibly effective at helping to repair injury. It's also good for sexual health. It's also good for hair, and it's really good for pain. So it's an amazing peptide. I love that peptide. I missed one?
Cmax, Sealink, and TB4.
And then Sealink. A brief overview on Sealink is that it's a nasal spray also, was really studied with anxiety, but in higher doses, which were studied as safe, it was also very analgesic. So it helps with sleep, it helps with anxiety and mood, it helps with cognition, and in higher doses was helping with pain.
Wow, great job getting all that. Lots of hearts and thumbs ups for that answer. Thank you, Dr. Heather. Okay, Lisa asks, just started with peptides with a doctor here in California, but
congratulations! Woohoo! Amber.
She is using a compounding pharmacy, which is very expensive. Can you recommend a company that is reliable to purchase peptides?
That's kind of hard for me to answer because I'm not sure expensive, meaning how expensive. I guess I'm not quite sure what is that $100 or is it $300? Certain peptides are more expensive than others. That's 100% true. The range goes anywhere from $80 to $100 up to $600 for certain peptides. But in general, so I'm not sure I don't know how to answer that. I don't know how to answer that.
Can you recommend a company that is reliable to purchase peptides? I guess was the ultimate question.
But you can't purchase peptides.
For her doctor, I think she was asking.
For her doctor to prescribe them. Yes, there's several pharmacies. I use tailor-made compounding for most, all of my peptide things. But there are several others that I know of that are legitimate pharmacies. So I'd be happy to talk to your doctor if you'd like.
Lisa did chime in. She said PT 141, $230.
Is that for 2 milliliters or 5 milliliters? Do you happen to know? No, I'm sorry to be so specific, but they do make it in a 2 ml and they make it in a 5 ml. That sounds pretty close to right.
Okay, we'll see if she responds. If we do, we'll get back to her.
Sounds pretty close to right because it's a very small dose of PT 141 and you're probably not going to use it more than 3 times a week. So one bottle should last you a while.
Amber is asking, do you have a peptide price sheet?
Oh, I wish.
Along with that question.
No, I don't. I'm not the one who sets the prices for the peptides. That comes from the pharmacies. And most of them are pretty close to each other, though, the legitimate pharmacies. If you see a peptide for $15, I would run the other way. It's a certain amount of money for them to actually make these. It's complicated science. They have to do purity testing. They have to do stability testing. They have to do all of that, which takes time and money. And they have to actually make the peptide and make sure that it is what it's supposed to be. So they're going to be more than $15. I'll say that.
So Lisa did get back with us. She said 2 ml, and they are using TaylorMade now. So
that sounds right. That sounds like it's about the right price. And hopefully, the dose for PT-141 can go anywhere from 10 units to 30 units, mostly for women. I always suggest starting with the 10 because you may not need higher doses, and that's going to make your bottle certainly go a lot longer.
Okay, Iris asks, I'm in Canada. Do you know of and approve of a provider here?
I wish I knew of a Canadian provider. I don't right now, but I can do a little checking for you with some reliable sources. If I have a way of getting back to you, I'd be happy to do that.
Yeah, so Iris, you can just send a message to drheather.net/contact, fill out that form, and we can get back with you. Chris is asking a follow-up question about the arthritis peptide that you mentioned. He said, could you please spell the peptide you recommended for arthritis?
Pentosan is Pentosan, polysulfate, Polysulfate.
Okay, I will reply to Chris on that. Okay, let's see. Nicole asks, do you have any experience with MK677?
I do. It's not a peptide that I use very much because it's easy to overuse it. It's an oral form of a growth hormone secretagogue. It's very potent, and it really should only be used in certain people and for a very short period of time, because that peptide can actually cause your receptors to just start to downregulate, and you can lose receptors, and you can have what we call tachyphylaxis, where none of them work anymore. It's one of those that is excellent if it's used properly for a very short period of time for a specific purpose. And some patients really aren't candidates for it.
Okay, Peter asks, does GHK copper work as well as a facial cream?
Which facial cream?
I don't know.
It works beautifully as a facial cream. And yes, there's multiple different things you can put together kind of in the peptide world to make a cream have some of these benefits. But having a facial cream that has copper GHK in it in a transport mechanism that it can get through the skin, in the skin and through the skin is the thing that you want to make sure you have. You don't want it just sitting on the surface of the skin. You want to make sure that however it's made, it has that delivery mechanism so it gets all the way through the skin and on the other side.
Okay, a couple more questions here. Let's try and get them in within the next 1 to 2 minutes. Dr. Heather's very busy today, but boy, we've got so many great questions.
This is great, though. This is wonderful. Thank you so much for all of you for coming out and interacting with me. I love it. Thank you.
Kathleen asks, do you take CJC 1295 and Impamrellon in the morning or night? It's an amazing combo. I was shocked to experience deep sleep and actually dreaming immediately after the first injection.
Yes. So wonderful. I'm so glad you're using that peptide. It's a great peptide. And yes, it really helps with the sleep. And it's not just putting you to sleep, it's quality sleep, which is what your body really needs. CJC Impamrellon, the combo is usually started and sometimes always kept as only a nighttime dose. There are circumstances when you would use it in the morning or during the day, but the standard would be to be using it at night. Our biggest growth hormone pulse of our natural rhythm happens at night. And the goal there is to capture that pulse and let that pulse be bigger with that peptide, the growth hormone releasing hormone and the growth hormone releasing peptide together. And you're getting tremendous benefit by getting that nice big pulse of growth hormone at night, better sleep, more recovery.
Great. Nicole asks, question about compounding pharmacies. Do they produce their peptides in-house, or are they getting their raw materials from other sources and countries?
That's a great question. That is probably not a question I can answer because I don't have a compounding pharmacy, and I can't speak for all of them. I can tell you that there's only a few manufacturing facilities around the world for peptides. So a lot of the compounding pharmacies are sourcing from one of those manufacturers, but not all of them. So it's really, that's about as blanket of a statement as I can make, is that some are making, but a lot of them, especially the more local, are getting them from one of the major manufacturers. So it's going to go both ways.
Okay, and I think the last question we have is from Chris. He says, which peptides are good for joints suffering from arthritis?
So I had the Pentose and Polysulfate was really studied with joints, and it's a wonderful peptide for joint problems. So is BPC 157, and so is copper GHK. Totally different mechanisms of how they would work. There's also a combination peptide of AOD 9604 combined with hyaluronic acid. Hyaluronic acid is the gelatinous stuff that's in Synvisc and Euflexa and Orthovisc, also in the facial fillers, the Juvederms and the Volumas. Those are all different formulations of HA. And they made a combination product with the AOD 9604 with HA, and it was studied in knees, and the results were phenomenal. So that's not injecting in the skin. That's actually putting it in the joint. But the Pentose and Polysulfate was the one I mentioned before that was actually researched and shown to actually have the outcome with some regrown articular cartilage and significantly less inflammation.
Okay, one final question I missed, and that was, Dr. Heather, are you taking new clients in your office yet?
Absolutely. I am taking new patients. Yes, we have a few different ways of becoming a patient of mine. We try to make it as easy and available as possible for you to kind of look at on the website. We have the contact us form. We have, you can let us know which service that we offer here that you'd be interested in. And absolutely, we'd love to welcome you into our practice.
And for those who might be interested in becoming a telemedicine patient as well, there's that form that they can fill out at drheather.net/contact some medicine. You're able to, or some patients you're able to help through telemedicine. And
some we are, yes.
That's where they can contact you. Let's give everybody that guide again.
Okay.
And you also have a free gift for physicians and for providers. Maybe we can talk about that.
Yes, and so anyone who's seeing this who is in an area where they'd really like their doctor is a doctor who loves learning how to do new things and wants to be cutting edge with technology and maybe doesn't know about peptides yet, please feel free to share our information with them. I love to get really solid protocols in the hands of more doctors, and we do that. So the link for those of you that want to see that Peptology guide is drheather.net/Peptology guide, and it's a free gift. It's a little PDF that you can look at and learn more about peptides. And then for the physicians that might want to train with me in peptide protocols, it's drheather.net/Peptology protocol, right? The Peptology protocol. And yeah, I would love for everybody to have more exposure and use of peptides. It's such an amazing new form of wellness and preventative health.
And very soon on an upcoming live stream, you're going to be revealing a little bit about your new course coming up on Peptology, right? I don't know how much you want to tease about that, but we've got an announcement coming soon.
Coming soon. We're going to make it easy for any of the physicians to learn and use these protocols. Yes. So I guess that's as much as I can say.
That's it for now. That's all the questions we have. Any final thoughts, Dr. Heather?
I'm so grateful again that y'all, came and joined us here and are interested in peptides. And those of you that have experience using peptides, share the word with your friends and your loved ones. It's such a wonderful, wonderful area of medicine to know about and to be able to utilize. And we'll get through this, what we can use right now, what we have to wait on, and figure all of that out together. So, but peptides are here to stay. There's just more and more research that's coming out, and it's very exciting. And I'm really grateful. I hope you all stay well. I hope to see you next Friday. And thank you again for joining us. Thank you. I'm so grateful. Thank you again.